Hi everyone, my name is Dr. James Cuffe and I'm a research scientist that focuses on thyroid health in pregnancy. I would like to start by saying thank you to the American Thyroid Association and all of their wonderful donors for their generous support of my research focused on understanding the impact of thyroid autoimmunity on adverse pregnancy outcomes. Thyroid dysfunction in pregnancy is known to lead to a range of poor outcomes for the mother and her developing baby. Fortunately, most women with overt thyroid disease receive treatment to prevent these poor outcomes. There are many other women that have more subtle forms of thyroid disease that go unnoticed in pregnancy. Perhaps the most common undiagnosed presentation of altered thyroid health is thyroid antibody positivity. This simply means that a patient has circulating antibodies that recognize proteins from the thyroid gland. Such antibodies can lead to a range of changes in thyroid function, but for many individuals, thyroid antibodies exist long before any changes to thyroid function and can cause no immediate changes to how the body works. However, research has demonstrated that once a woman with thyroid antibodies becomes pregnant, she is more likely to develop a range of poor pregnancy outcomes, even if all other markers of thyroid function appear unchanged. This suggests that these thyroid antibodies may be directly altering the function of reproductive tissues and contributing to poor pregnancy outcomes. Given that up to 1 in 4 pregnant women are thyroid antibody positive, there is an urgent need to understand how these antibodies are impacting pregnant women. This research project, which was generously funded by the American Thyroid Association, will focus on characterizing the effect of thyroid antibodies on blood vessels which support the placenta and growing baby during development. This project will use a number of different laboratory techniques, including growing cells from the walls of blood vessels in an artificial setting with different concentrations of thyroid antibodies present. It is expected that this study will demonstrate that thyroid antibodies disrupt normal pregnancy-specific changes to blood vessels, and through that mechanism, lead to poor pregnancy outcomes. With the financial support provided by the American Thyroid Association, I hope my research lays the platform for future work that helps ensure better outcomes for babies impacted by thyroid antibodies in pregnancy. Thank you.